Baking soda has been used since ancient times as a deodorizer, a soother and a cleanser. Its uses range from basic daily hygiene, like toothpaste and shampoo, to health benefits including digestive issues and even kidney problems. Sodium bicarbonate, bicarbonate of soda, and sodium hydrogen carbonate are some of the names for baking soda. Its chemical formula is NaHCO3. This represents the composition of sodium and bicarbonate ions. It's a substance that's known for its alkalinizing effects, with having a pH of 9. Some people get confused with baking soda versus baking powder. Baking soda is a chemical leavening agent, and so is baking powder. This means when it's used in baking, both the baking soda and the baking powder cause batter to rise. Throughout history, it's been used as a rising agent when baking. It's 100% sodium bicarbonate, so when it's mixed with an acid, it makes bubbles and it gives off carbon dioxide gas, causing the dough to rise. Baking powder and soda are similar, yet different, since baking powder is made up of sodium bicarbonate and one of multiple acid salts. Baking soda is known to help to neutralize acid and to improve the pH balance in the body. It's often used internally to quell digestive dismay, such as acid reflux or heartburn. When these complaints are due to the overconsumption of acidic foods or a generally acidic state in the body. Slowly drinking some baking soda in water can help to neutralize the acid and get your body's pH back to a better place. Baking soda has been shown to kill off bacteria, including Staphylococcus mutans, which is a type of bacteria that's associated with tooth decay. It's also effective against various fungal groups, including yeasts, dermatophytes, and molds, that can cause skin and nail infections in humans. Research shows that baking soda use includes the promotion of kidney health. A clinical study published in the Journal of the American Society of Nephrology looked at the effects of sodium bicarbonate on 134 patients with chronic kidney disease and low blood bicarbonate levels. The subjects who supplemented with the bicarbonate tolerated it well, and they were significantly less likely to experience the rapid progression of their kidney disease. Additionally, there was less patients that developed end-stage renal disease in the bicarbonate group when compared to the control group. Overall, the researchers concluded the study demonstrates that the bicarbonate supplementation slows the rate of the progression of renal failure, and it improves nutritional status among the patients with chronic kidney disease. According to the CDC, urinary tract infections are one of the most common infections, and the Mayo Clinic points out that women have a higher risk of developing a urinary tract infection. A scientific study published in 2017 looked at the effects of baking soda on female patients with lower urinary tract symptoms who also had acidic urine pH lower than 6. After 4 weeks of taking it orally, the researchers found the urine of the subjects was alkalinized, and there was a significant level of positive effects on symptoms and the symptom score. Overall, baking soda appears to be an easy, inexpensive way to improve UTI symptoms accompanied by acidic urine, and little to no unwanted side effects accompanying it. A scientific article published in 2013 titled Practical Considerations for Bicarbonate Loading and Sports Performance points out that studies to date have demonstrated taking sodium bicarbonate before exercise, also known as bicarbonate loading, can have a moderate positive effect on the athletic performance that includes 1 to 7 minutes of sustained strenuous exercise. In addition, the sodium bicarbonate may also be helpful for prolonged physical activity involving intermittent or sustained periods of high-intensity training. So there's a benefit to using baking soda for training. According to the authors of the article, Dr. Louise Mary Burke, it could be very useful to try and to support the training session to allow the athlete to train harder, but also to reduce some of the negative effects of having high acidity in the muscle, so that you can get less damage to the muscle and a better training outcome in the long term. Another small clinical study on 8 healthy men found consuming the baking soda before intermittent cycling improved their sprint performance. Chemotherapy side effects make the list of baking soda use for health. If you or someone you know has gone through chemotherapy, then you probably already know how bad the side effects of the cancer treatment can be. For example, the undesirable changes to the mouth and the throat that can occur in some patients. Rinsing with a baking soda mixture daily can help to improve these unwanted side effects. Combine 1/4 of a teaspoon of baking soda, 1/8 of a teaspoon of salt, and 1 cup of warm water and rinse your mouth 3 times per day. Each time, follow the baking soda salt mixture with a rinse of just plain water. You can create your own deodorant by mixing a teaspoon of baking soda with enough water to create a milky baking soda paste, then rub it under the underarms or even on your feet. You can remove dry skin from your face by creating your own baking soda exfoliant. Combine 1 teaspoon with 1/2 cup of water and then rub it on your face in a circular motion. Then rinse. Using the baking soda for face exfoliation is an inexpensive way to refine the skin. Just don't use it too frequently because you don't want to upset the pH balance of the skin. To scrub away dirt and odours, mix baking soda with warm water and rub it on your hands. This natural hand cleanser will leave your hands clean and soft. You can create your own foot bath with a tablespoon of baking soda and warm water. This baking soda bath will remove bacteria and odours, and it can help to prevent toenail fungus. Baking soda can help to reduce discomfort from sunburn, allergic rashes, and skin that's affected by poison ivy or poison oak. Mix a teaspoon with some water to create a baking soda paste and apply it to areas of concern. Leave it on for several minutes and then rinse. You can do this a few times per day as needed. Splinters will come out naturally after a few days of soaking in baking soda. Use a mix that includes a tablespoon of baking soda and warm water. Soak the affected area twice a day in this. Rubbing baking soda on a bug bite can relieve the itching. You can create a paste with a teaspoon of baking soda and water and keep applying the soda paste about 3 times a day until the bite disappears. Fragile sunburnt skin can benefit from soaking in a mixture of baking soda and water. Soak in a warm bath that includes 1/2 cup of baking soda. You can also mix it into your favourite body lotion to calm a sunburn. You can add a teaspoon of baking soda to your shampoo and rub it into your hair and rinse as usual. The baking soda shampoo is ultra clarifying, so it's a great way to remove dirt and oil, as well as residue that's left over from hair products. You can create a paste by combining 2 teaspoons of baking soda with 1 cup of water and coat your brushes and combs with this paste and then rinse thoroughly. Baking soda toothpaste is a great way to improve dental health. It's known to increase plaque removal. That's why it's commonly used in both conventional and natural toothpaste. Straight baking soda has abrasive qualities, and over time it can wear away at the enamel. Instead, to keep fresh breath, you can add it to your toothpaste. Make your own homemade toothpaste, or just dip your toothbrush in the baking soda a few times a week. To keep your teeth looking white, you can create a paste with a teaspoon of baking soda and water. Once a week, rub the paste onto your teeth. Let it sit for 5 minutes and then rinse your mouth. This is a great natural way to whiten the teeth and to kill bacteria without any harsh and questionable chemicals. Conventional manufacturers of heartburn medication include sodium bicarbonate in their formulas. It's a cost-effective way to reduce heartburn and indigestion, as opposed to other options like Tums and Rolaids, which also contain bicarbonate. Simply add 1/2 teaspoon to 2 cups of water. An hour after eating, drink the mixture to gain relief. When you have a pH imbalance, unhealthy organs are able to flourish, and this can damage tissues and organs, and it can compromise the immune system. Baking soda is known to increase the pH of acidic tumours without affecting the pH balance of the healthy tissue and the blood. Scientific research has demonstrated that oral doses of sodium bicarbonate can raise the tumour pH and can inhibit spontaneous metastases in animal models of metastatic breast cancer. Baking soda benefits can carry over to exercise routine. Soaking in a warm bath with a half a cup of baking soda is said to neutralize the lactic acid buildup in the muscles after exercise. As an alkaline substance, baking soda buffers acid in the body and it helps to keep the pH level balanced. Low-functioning kidneys have a hard time removing acid from the body, so consuming the baking soda can help. Because baking soda neutralizes stomach acid, it can be helpful for ulcers. You can make a natural scrub by adding a teaspoon of baking soda to water. This pasty mixture is perfect to remove bacteria from fruits and vegetables. If you experience a minor grease fire in the kitchen, you can use baking soda to extinguish it. Baking soda uses historically include a natural treatment of the common cold and the flu. The recommended dose from the Arm & Hammer Company for colds and influenza dates back to 1925. The company broke the dose up into 3-day periods. Day 1, the first day, consists of 6 doses of half a teaspoon of baking soda in a glass of water at about 2-hour intervals. On the second day, the company advises that the individual take 4 doses of a half a teaspoon in a glass of water at the same intervals. And on the third day, 2 doses of a half a teaspoon in a glass of cold water, morning and evening. And thereafter, a half a teaspoon of baking soda in a glass of water each morning until the cold and flu symptoms are cured. To calm an episode of indigestion, a common dose recommendation is adding 1/4 of a teaspoon of baking soda to a glass of water. This can help to reduce stomach acid, but it's important to remember not all indigestion is caused by an overproduction of acid, so if you still have symptoms 2 weeks later, speak to your doctor. It's best to slowly sip a baking soda and water mixture when taking it internally to avoid the mixture not being fully dissolved. You should avoid taking more than 3.5 teaspoons in a day. Taking more than 1.5 teaspoons a day if you're over 60 years of age. You should avoid taking the maximum dose for longer than 2 weeks. Avoid drinking the baking soda solution too quickly. You should avoid taking baking soda when overly full to avoid gastric rupture. Baking soda use for the skin or the body is generally considered safe and non-toxic. Consuming it orally is also safe when you don't exceed the recommended dose. Taking too much baking soda can upset the body's acid-base balance, and this can lead to nausea, vomiting, and abdominal pain. Rare cases of baking soda overdose can lead to seizure, coma, and even death. It's high in sodium, 1,259 milligrams per teaspoon, so high doses are not safe. High doses can raise blood pressure and cause swelling. In severe cases, it can overload the circulation and lead to heart failure. People who consume too much baking soda have reportedly developed blood chemistry imbalances and heart malfunction, or ineffective pumping. Another reason to not overdo the consumption of baking soda is it can increase potassium excretion, which could lead to a potassium deficiency. If you have edema, liver disease, kidney disease, or high blood pressure, you should avoid taking it internally. You should also refrain from consuming it if you're pregnant or breastfeeding. If you're on prescription drugs, you should consult a doctor before consuming it, and make sure that you speak to your doctor about drinking the baking soda if you're on a sodium-restricted diet. You shouldn't take it within 2 hours of taking other medications. It's also not recommended to give it to children under 6 years of age unless directed by a pediatrician. If you've been using the baking soda for a medical condition and it's been more than 2 weeks, it's a good idea to see a doctor to be sure that you can continue to self-medicate. Some products can can interact with baking soda, including aspirin and other salicylates, barbiturates, calcium supplements, corticosteroids, medications with a special coating to protect the stomach, lithium, quinidine, and diuretics. You should speak to your doctor before using sodium bicarbonate internally if you're using any medication. For the low cost, it's one really affordable natural remedy with a seemingly endless list of uses, like cleaning your bathroom to cleaning your face, to calming indigestion and even providing a workout boost. For more information about herbs, supplements and natural treatment options, check out my website.